There are nearly 300 different ways the upper cervical area can misalign, so there are no cookie-cutter corrections to this part of the spine. Dr. Christina Koblish and Dr. Ryan Mosque are a husband and wife chiropractic team that specializes in the Blair upper cervical technique, focusing on gentle approaches to address this sensitive area.
At Upper Cervical Chiropractic of Boulder, we utilize the most specific form of chiropractic care, Blair upper cervical. This technique focuses on making corrections to misalignments in the top part of the neck where the brainstem sits. This technique is done without the use of twisting, popping, or cracking in the neck. The adjustment is precise, light, and very quick. The amount of force that we use is very minimal, and our patients appreciate that we do not have to twist the neck in order to make corrections. Our technique allows us to be as specific as possible when delivering the corrections, which leads to incredible results. The most common things that we help patients with in our office are neck pain, upper back pain, headaches, migraines, shoulder injuries, TMJ disorders, tinnitus, and vertigo. Upper cervical care is also ideal for those who have had lower cervical disc injuries or fusion surgeries to their neck already. As we stabilize the upper cervical spine, it will strengthen the rest of the neck.
At Upper Cervical Chiropractic of Boulder, they use the latest 3D technology in their practice to analyze the upper cervical spine. Let's learn more.
Our goal is to be as precise and specific as possible when making corrections on a patient. We capture CBCT images, which produce a 3D rendering of the upper cervical spine. This scanner creates an amazing 3D model of your cervical bones. This shows exactly where your bones are sitting, and we can then use this to make appropriate corrections needed, one bone at a time. We also use a differential paraspinal thermography scanner, which allows us to do a before and after scan at every visit for each patient. This allows the patient to see exactly what they look like when they came into the office and how they have changed after they've received treatment that day. This also holds the practitioner accountable and verifies the change that we are intending to accomplish is actually taking place. With each visit, the patient knows that their body is functioning better than before they came in. More importantly, the thermography scanner tells us if you even need an adjustment that day.
One major goal in upper cervical care is to teach the spine to hold the corrections that we give you. Because upper cervical chiropractors cut out virtually all of the guesswork by using objective scans each treatment, delivering precise corrections to just one bone at a time, and then evaluating, this means that we have less visits for our patients over the course of their care.
About 2 years ago, I had a very serious migraine that I could not get rid of. I went to the hospital multiple times for it, and each time they would just pump me full of migraine cocktail and send me home. I've got MRIs and CTs done of my head, and nobody could figure out what was wrong, so eventually I just decided to come here, and after about 2 or 3 visits, my migraine was gone, so it was literally like magic.
Dr. Christina Koblish and Dr. Ryan Mosque at Upper Cervical Chiropractic of Boulder are on the forefront of chiropractic care. Their purpose is to deliver specific corrections to the upper cervical spine. This helps you achieve your health goals by stabilizing your spine with as few corrections as possible.